Welcome, everyone, to the COVID-19 CommunityResources.com town hall meeting powered by the Center for Closing the Health Gap. Today, we have a jam-packed double session, and we're going to go straight from the first session into the second. So you want to make sure you have your coffee, your tea, you're sitting back, you're relaxed, and you're ready to get your questions answered. I am your moderator, Cincinnati City Council person, Jan-Michele Kearney. In the first session, we'll discuss how we stay safe as the state slowly reopens and what this means for hospitals, the general public, and our schools. Then, as I said, we'll go straight to our second panel in hour number 2, and we're going to talk about education and how education will be continued and is being continued at home during the COVID-19 pandemic. So sit back and relax, and we're going to get started. Just a few quick housekeeping items. First, I want to thank our producers and tech team, Renee Mahaffey Harris, President and CEO of the Center for Closing the Health Gap, John Reichel, our tech guru, our tech genius, I should say, Lauren Harden of the Health Gap, Renee's daughter Sloan, my daughter Celeste, and John Reichel's daughter. And John, I'm going to have to get your daughter's name because this whole team is working together to make this happen. So they're going to make sure, attendees, that you're unmuted if you have a question, if you're joining us by Zoom. If you're on Facebook, you can text in your questions and we will have them here and we will ask our panelists. Also, please note that both sessions are recorded so that we can post them later. Okay, let's get started. So our featured guests for the first hour, we're so excited to have this really power-packed panel. And you might just raise your hands, panelists, as I call your name, okay? So we have Dr. Michael Thomas from UC Health, Dr. Opeolu Adeoye from UC Health, Laura Mitchell, our Cincinnati Public Schools Superintendent, and Director Ursel McElroy of the Ohio Department of Aging and co-director of the Governor's Minority Strike Force. So we are ready. Before we take the first questions, I would like for each panelist to share just a few brief remarks to get us started. Let's start with Dr. Thomas.
Hi, if you can hear me okay, my name is Dr. Michael Thomas. I've been at the University of Cincinnati now for 32 years. I am in the Department of Obstetrics and Gynecology, and I am currently the department chair. I've been the chair or the head of the Department of OBGYN now for 2 months, right in time for the pandemic. So it's a very interesting thing. I've served most of my time in Cincinnati as a fertility doctor, and I take care of women with menopause, but now my goal is to make sure that our pregnant patients and the women in general in the Cincinnati area and the Cincinnati region are taken care of during this pandemic. And we are doing a lot at UC Health in order to make sure that that happens.
Thank you so much. Okay, Dr. Adeoye.
Thank you very much for having me, Ms. Kearney, and to the group at large. I am Dr. Adeoye at the University of Cincinnati. I am a newbie. I've only been there for 18 years, and I am an emergency physician. I'm also the co-director of our stroke team. So our stroke team covers all hospitals in the region, in addition to UC Medical Center and Westchester Hospital. And so I split my time between taking care of stroke patients as well as taking care of patients in the emergency department.
Thank you so much. Okay, Ms. Mitchell.
Hello, everyone. Good afternoon. Thank you so much for having me today. I'm very excited to talk about what's going on within Cincinnati Public Schools and also to be able to answer questions. So you all may know that we have over 36,000 kids, about 5,000 employees, over 65 different sites. We also have 24 school-based health centers, and so we provide health services to our kids, usually 5 days a week when our kids are in session. So when I think about what's been going on most recently as it relates to this crisis, we have been in the first couple of weeks in crisis mode in terms of making sure that our kids have all their needs met. And so we kept a number of our health-based centers open. We've also been providing meals to our kids 3 days a week, and they pick up more than one meal each day to cover them for a week. So we've served over 100,000 meals to our kids. We're at the point now, though, maybe about 2 weeks ago, we started to take a pivot from crisis mode into thinking about and really working on recovery and what will life look like in Cincinnati Public Schools as it relates to the future. And so we are very much future focused at this point in terms of education and services that we provide for not only our kids, but also our families. So again, thank you so much for having me. I appreciate the opportunity.
Thank you so much for joining us. Okay, next we have Director Ursel McElroy.
Yes, good afternoon. Thank you for having me. I look forward to talking with you and hearing from your listeners. I am the director of the Ohio Department of Aging, and simply that means I have the awesome privilege of representing 2.8 million older adults within our state, their families and their caregivers. During this COVID-19 crisis, I've also had the privilege to be entrusted with co-chairing the governor's minority health strike force. So I'm really looking forward to this conversation here today. I can tell you that in so many ways, I've spent my whole life helping people, preparing people, but I've never seen anything like this before. And I can tell you also that I've never felt as good as I have about the leadership we have now with Governor DeWine, Lieutenant Governor John Husted, and Dr. Amy Acton. And so I look forward to sharing with you what we're doing, what we certainly need your help to continue doing so that we can be really strong, both in our efforts to respond and also our recovery.
Thank you so much. I was going to say, I think everyone has fallen in love with Dr. Acton. She's got that calming voice. I look forward to hearing her at 2 o'clock every day. So she's going to have to keep on even after this pandemic is over. So, okay, we're ready for questions. I know we had a slight tech problem, and I know John is fixing it, and John's daughter, Maddie, thank you so much. There are a few people who are trying to ask questions on Zoom, and I know that link is being taken care of. So hold on, we'll get to you in just a second. The first question that I have is for Director McElroy, and it says, what does yeah, how about that? What does partial reopening of the state mean? What are the rules? Who's open?
Okay, so one of the things we wanted to be certain in the reopening is that we were thoughtful. We believe we made really good progress, but we also know the virus still is very much out there. And so we also knew that if we were going to reopen, we had to have some of the right tools in place. And so we feel really good now that we are continuing to ramp up our efforts with testing, contact tracing. We're not everywhere we need to be with our personal protective equipment, but we're continuing to work to be sure that we have that in the places where we need to have that. So some of the places that we were able to responsibly begin to open up is in our healthcare sector. There are places where we are slowly opening, where we believe that people who need the care will be able to access the care. One of the things around that is we were very concerned about the surge on the hospitals. And again, because of the great work that people have done, we believe that we have some capacity to be able to open other things up. In addition to that, you will see there are places with respect to manufacturing and retail that we are slowly opening up, sort of phasing in. So there are some things that opened up this week, some that will open up next week, and some even the week after. But there are still some continued closures. So for example, in the area that I work in with aging, many of our long-term care facilities, the restrictions on visitation as it stands today remain. That is a place where we continue to try to put in place the best measures, but it is a congregate setting, and so it poses different challenges for us. There are certain daycares. There are certain centers that, because of the congregate nature of those places, we have made some very deliberate decisions to be a little more slow in removing some of those restrictions and closures. So I would recommend, though, if people want a really complete list, again, to go to coronavirus.ohio.gov. That's coronavirus.ohio.gov, and you can see our plans, you can see how they're stepped out, and you can see exactly what's open, what isn't, and what's required within those respective places.
Thank you so much. And I should just point out to our studio audience out there that COVID-19communityresources.com will link you to the governor's website and link so that you can get all of that information. Director McElroy, just a quick follow-up. So I understand that businesses do have to have a plan for social distancing, but they don't have to require masks, although they could. It's up to the business, I understand, to determine if they are going to require masks.
Correct. And it also depends on the particular industry. So there are certain industries where it would not be advisable and others where it is. And so again, I would recommend, if you have a particular concern about your industry, that you would go to the website, because it lays out, and we actually have a fact sheet that talks very specifically about facial coverings and when it is required, when it isn't, what you can expect and not, both as an employee, an employer, and as a consumer of any of those respective industries.
Okay, thank you very much. Okay, we have another question. This one is for our doctors, Dr. Thomas and Dr. Adeoye. The question is, I'm 2 months pregnant. Are there special precautions I need to take?
I guess I'll take that one. Yes, I mean, I think that being pregnant, you probably need to definitely wear a mask when you're out. It's not thought that pregnancy in and of itself, there's not thought that the virus can transplant itself or transmit itself across the placenta. The biggest problem is when the baby's delivered, making sure that the delivery goes smoothly, and that in an ideal world, the mom can see the baby, and a significant other or partner or a family member can see the baby, and then the baby is separated. But at 2 months, not as much of an issue, but try to make sure, especially in a young patient, that they don't get the virus, and make sure that you wear a mask when you are out in public. But if you end up having any of the symptoms, cough, fever, chills, muscle aches, or muscle pain that you see, and make sure you point that out to your OBGYN provider. In your obstetrical office, we are now limiting a lot of these visits to preferably the patient only. Sometimes they need a support person, and that's okay if they really need a support person. But at that time, those patients are seen in a routine fashion, so that we can make sure that there's nothing going on. And most people who are coming in before delivery will be tested for COVID. We had a couple of patients just on Friday morning who came in who ended up being positive for COVID, and we only knew it because we did the testing. We were able to get tests back within 2 hours, and we took all the precautions so that that baby was delivered. And unfortunately, there have been some babies who, at the time of delivery, ended up developing the COVID, and only one so far has succumbed to that virus. So we're taking all precautions, because all these things that were said before, young people can't get it, babies can't get it, that's sort of out the window. We don't know as much about this virus as we think we did 2 or 3 weeks ago. We're learning more and more every day.
Right. Thank you so much. Okay, here's a question. It says, what can the average person do to help our school children during the COVID-19 pandemic so that they are ready for school in the fall? So that would be for Ms. Mitchell.
Yes, so we're thinking about school in the fall in 2 different ways, in terms of recovery and then also future thinking. I will also say this, though, we are very resolved to the fact that we should not re-enter school the way we left in March, in terms of our system has been disrupted. And so we're going to take advantage of this disruption to really change some of the inequities that you might experience within our school district and within our schools. And so I think that what can be done to really help our kids be prepared is to make sure that the kids are still doing their lessons. And so we provided lessons at the district level, as well as schools have provided lessons for kids. And so it's really important for our young people to be engaged in learning and to be doing those lessons, so that when we return, whatever that return looks like, that they're actually prepared, and that there isn't this huge gap in 10 weeks of their learning that's been missing. I will say, though, that when we go back, we will do a review for the first several weeks of the last school year, so of this school year, to make sure that kids are on a level playing field and are all ready to re-enter school. But we're not sure what that's going to look like. If there's social distancing that still needs to take place, if you think about a school, that can be really challenging because our hallways are filled with kids, our gymnasiums, our auditoriums, our lunchrooms. And so even if we lower the classroom sizes, when we think about those big open spaces, so there's a big opportunity for kids to come in contact with one another. And so we have developed a plan that will be launching relatively soon that speaks to how will school look in the future. And we're not just basing it upon this crisis, but we're also looking at how other countries have educated kids in very powerful ways and thinking about how we might adjust some of our systems to fit our new situation.
Okay, thank you. And there's another question here, and it says, will the schools open in the fall? I guess that's the starting question.
Sure. So this is what I say, and this is very true. Day one, our buildings closed, but education did not, and neither did our schools in terms of teaching and learning. And so our teachers are still engaged with kids through Google Meet. They're required to make contact with their class, each student once a week, either through phone call, through email, through Google Meet, through Schoology, which is a platform that we use. And so education is continuing. We also have something that is called CPS TV. So for those kids who don't have devices, they can go on a Spectrum and Cincinnati Bell, and there are lessons, and there's a schedule that says which lessons are produced each day by grade level, by content area. So I've been in conversation with superintendents all across the country every week about what does this look like in terms of social distancing and reopening our schools. And so there's one thought in terms of maybe there's a blended model and kids aren't at school every single day, but we're able to spread them out. So one week I may be going Monday, Wednesday, Friday, and the next week I'm going Tuesday, Thursday, and there's that flip off so we can try to minimize the number of kids we have in a space at a given time. So do we know that school will open in August? We know that learning will begin again in August as well as going through the summer. It may not look the way it did prior to March 16th when we closed the actual buildings. So we anticipate going back. It just may not be everyone's at school at the same time.
Okay. And Director Mahaffey, sorry, go right ahead.
Yeah, I could just say a public thank you to you as an educator. I actually have a son who's a senior this year. And so it's a very interesting time for us. And what has made the difference has been the faculty and the support. And so just thank you. I just needed to say that. Thank you.
Wonderful. Someone asked, and this is an anonymous attendee, which is fine. You don't have to give your name. And the question is, how are students able to access the lessons from their school?
Yes, so before we actually closed, so Governor DeWine announced on a Thursday that he was going to be closing school the following Monday. And so we were geared up and prepared, and we provided lessons for kids to take home. For those kids who maybe weren't in school, we copied 8 works with the lessons, weeks of worth of lessons, and GE Aviation came forward and they paid Federal Express thousands of dollars to copy these lessons for us. We have 23 meal hubs at our schools spread across the district from as far west as Sailor Park and as far east as Mount Washington. Elementary schools, high schools, all in between. And at those food hubs, 3 days a week, we gave out our lessons. In addition to that, Staples in the first 2 weeks came forward to us and they said, we really want to be helpful. Send us the electronic file of your lessons, and any parent can come into a Staples location and tell us the grade level, and we'll give them the lessons. And so that's how we have been able to get our lessons out. All of our lessons are also online, so cps-k12.org. In addition to teachers are contacting kids about very specific lessons for their classrooms that are using digital content. So we've tried a variety of ways of getting lessons out to our young people. Within the last several weeks, we also started to push out thousands of devices to kids. And so we were pushing out about 500 devices a day. And so we had 4 locations set up around the district where kids could come and check out a device to be able to use at home so that there wouldn't be this unlevel playing field for our young people. I will say that one barrier that many of our kids are still experiencing, though, even though they have the devices, is that many times families don't have access to Wi-Fi. And so if they don't have access to Wi-Fi, then it makes it hard for them to use the devices. And so that's an area that we're still really working with Verizon, AT&T, Cincinnati Bell to be able to help our families in that way.
Okay, thank you so much. I've heard something about hotspots might be provided. I guess that's kind of a work in progress, and so that would be really helpful. So that's great. Here's a question from Kevin Farmer, and he wants kind of everybody's opinion or whoever wants to answer this. But he said, do you believe that this pandemic, COVID-19, was blown out of proportion? And if so, why? If not, why?
I mean, I can take that from
not big enough deal. I guess that's really where we are with this.
If it's okay, I'll take that from just from an emergency care perspective. I have friends in New York. This is not blown out of proportion by any stretch of the imagination. Now, is it because New York is so dense relative to maybe Cincinnati or relative to other places? Maybe, but what we don't want to happen is to test that theory. As an emergency care provider, like I said, I've been here 18 years. It's never once occurred to me that if I drop a glove in the ER, do I need to worry about that? And we are still in a situation right now where our supply chains are affected. We can't reliably get the drugs that we need. We are making, we are being creative in how we are taking care of patients in a way that I have never seen. And a lot of that is not because this thing is blown out of proportion. It's because people are so sick that we rely on to do that work, that they are not able to do the work to get the drug from point A to point B for it to be available for me at the bedside to use. So my first response is from my friends in New York, this is not a joke, and we really need to take that seriously. And then the second response is just the fact that we are really struggling, and that struggle is not just because of the disease, but the impact of the disease.
I'd like to add on to that, just to say that, you know, from an OB standpoint, and we've had women who have been on ECMO who were pregnant. There was one recent case that came into the University of Cincinnati from Dayton, because we are thought to be, you know, a higher level institution for patients with problems. And they were on ECMO, where you are bypassing the blood in order to allow that person to live, as well as being on a ventilator. You know, we're having people in nursing homes passing away all the time from this disease. Anyone, and it seems to be obviously more concentrated in the African American community. I don't think we know exactly why that is. But, you know, it is so important just to do the simple things, because the curve is flattened, because the governor acted very swiftly to get things done. I think that we've been able to see some positive results. And I think people, because if you don't know anyone or if you don't see it yourself, you think it's okay and it's just being blown out of proportion, but it's not being blown out of proportion. There were direct and active measures taken in order to decrease the curve getting any worse. It was definitely expected to be much worse. So washing your hands often, avoiding close contact, covering your mouth and nose with a cloth when you're around others, cover coughs and sneezes, and cleaning and disinfecting all the time. These are the things that we have to do to get and to continue to keep this virus under control. It's not going to go away until we get vaccines and all the things that we are a year away from. The best thing to do is to try to do these simple things that I just mentioned in order to decrease the chances, so that there are some people out there who don't think it's as serious as it is, but it's deadly serious.
And does anyone have an idea when it is going to go away? I mean, when are things getting back to normal? Maybe there'll never be that same normal again. I don't know. Does anyone have an idea about that? Medical community, Director McElroy, where are we with this?
I don't know if Dr. Opeolu would like to make a comment, and then I'll say something after.
Okay.
I think it's premature to say, honestly. And I think the best bet we have is sort of watching what's happening in Wuhan and seeing a little bit of a resurgence that's happening once things were open. There are also, of course, lessons to be learned from 1918. And the lessons from 1918 again showed that double bump in lots of places where you first sort of have the peak. We think things are under control, we let it go a little bit, and then we get another peak. The question then is, do we have a similar post-double peak course as the 1918 pandemic? And at this point, I just don't think we know if this is going to go away or if this is going to be something that keeps coming back over time.
Yeah, I completely
One of the
agree.
worst things is not knowing. I'm sorry, Dr. Thomas, go
No,
right
I
ahead.
was going to say, I completely agree. Until we get a vaccine that's usable, I know that there are a number of companies that are working on a vaccine that would be helpful. But until then, I think you have to continue to take these measures that I sort of mentioned that came from the CDC. But you know what? The biggest problem is that you don't know who has it and who doesn't have it. Out of the 2 people we saw the other night who were tested, one was completely asymptomatic, had no symptoms whatsoever, and one had a headache, just a mild headache. And so you don't know who to avoid and who not to avoid. One of the biggest issues is that 44% of the people in New York, there was one study in this journal Nature, 44% of the people, actually it was in China, 44% of the people in China who got the disease from someone who is completely asymptomatic.
Okay, thank you. And then this is kind of a follow-up to that discussion. Someone said, is it safe to even partially open?
Well, and I'll go ahead and take that one. So there were a lot of factors under consideration with as we begin to reopen, with the partial reopening. One, I think, we've heard the governor and the lieutenant governor state that we have both health concerns, there's an impact, and there's also an economic impact. And we know that there's actually a relationship between the two. And what we're finding is, we believe that because of the great work that people were doing, and also mentioning again that we were being able to increase our level of testing. We're also able to increase our contact tracing, and also continue to put things in place with having the proper PPE, the personal protective equipment. And we know these are things that we have to continue to work on. We believe that we were at a place that we could do this, but do it responsibly. So that's why you still see some continued closures. That is why you see, even with the reopening of some of the businesses, that there are some pretty, we believe, stringent guidelines that we're asking them to follow. And I might say this too. I would also encourage people to also make some really good personal decisions around this. I mean, if certainly if you're an individual who may have some underlying conditions, maybe you have diabetes, maybe you have some respiratory conditions, think about where you should frequent. I mean, you still have some ability to make some decisions here as to where you go and how you go and what you can do to protect yourself as best possible when you go in those spaces. That's social distancing, wearing the masks, the facial coverings if you are able to do that, certainly goes a long way. The frequent hand washing. And here's the other thing too. You'll also begin to see there's also, particularly and I think it's really important in this space to bring up, particularly in some of the minority communities, right? I think also our messaging and making sure that we are putting out messages to answer questions such as the one we got, which I appreciate from the participant. Is this blown out of proportion? Well, I would say no. Every day at 2 p.m., the Ohio Department of Health does publish numbers and data and information. And part of that information is we're really trying to get a better picture or look into different communities, in particular, and the impact. So I pulled 2 p.m. numbers for today, and it showed, as of the data we have today, that with respect to African Americans, they represent 26% of the population of those that reported race and ethnicity in our data. And that's concerning, particularly when you think at only 13% of the population is African American. So we do have some concerns around the disproportionate impact. And I think there are a variety of things here that contribute to that. So the point is, are we opening? We're opening responsibly. We are monitoring, we're looking, and again, I want to focus that we've put some stringent things in place, along with making some decisions to keep some things closed for a bit longer until and if we get to a place of where we feel that we can responsibly open.
Okay, we appreciate that. And that kind of goes right into a question from Beverly Alexander, who said, I just left Walmart and there were so many people not wearing masks or gloves. So her question is, should I not go into these stores? And if I do, how would I avoid, the folks not wearing masks or gloves, even if I'm 6 feet apart and we're passing each other? Or I guess she's saying you can't really be 6 feet apart because you're passing each other in the aisle of the stores.
If I may make a piggyback comment to Director McElroy's comments that tie to this. One of the things that I think Dr. Thomas has stated a few times over is how people who are not symptomatic actually are the people that are spreading the illness. And so we're talking about people who maybe have some risk factors and sort of trying to get them to protect themselves in some fashion. But I would just implore the young, the healthy, the asymptomatic, that you are a vector until proven otherwise. You are disseminating the virus until proven otherwise. And so I would just implore the people who are supposedly asymptomatic and healthy and this is not going to affect them, you are exactly the person that should be wearing a mask. And so I'll defer to Director McElroy on going to the store and not going to the store, because there are clearly some policy and other issues that impact that. Well, I just wanted to make that point about the asymptomatic people.
Yes.
That's pretty scary. So any of us who haven't been tested could be carrying the virus. So yeah.
Yeah, and that just sort of gets back to what we said before. Wash your hands often, avoid close contact as much as you can. Cover your mouth with a cough and sneeze. We know to sort of distance ourselves even further than 6 feet from the people who are coughing and hacking or sneezing. But we don't know about the person who's just behind us breathing. They may be the ones that are the asymptomatic folks, and also cleaning and disinfecting as much as possible. You don't need wipes, you can just need paper towels and just some bleach, whatever you can to disinfect your areas, disinfect. I know when I go to get gas, I try to wipe off the gas pump. I try to wipe off my steering wheel after I do all this stuff. I mean, you just have to think defensively when it comes to trying to decrease the chances of getting the virus, because the virus can stay on surfaces for a prolonged period of time. So it's just not that asymptomatic carrier, but it's also the surfaces that you touch and come in contact with.
Absolutely. And so to the question, around the particular store, not knowing, that particular store, what I would say for any business, a business would want to do things that would make you want to feel safe to come in. I mean, I think it's just good business. Otherwise, you risk the possibility of someone not frequenting your business. So there are industries or businesses that have done things such as only allow a certain amount of people in at a time. I am aware of different businesses that have, in terms of their aisleways, they have now made them one way. You can only come one way depending on which aisleway that is, so that minimizes that back and forth of seeing each other or having the potential of being as close to one another. They have different hours for different groups, right? There are some stores and different retailers that have decided maybe early morning for an hour or 2 hours. These hours will only be reserved for maybe individuals 65 years in age and older. You have some, when you come in, they wipe down things before you touch them. So my response is, again, I would say exercise your best judgment and what works best for you. And to the doctor's point, certainly be on the defensive. Make sure that you have on your facial covering. Make sure that you are continuing to clean your hands, keep the distancing. You know, I did have to, I think it had been almost 3 weeks, I had to go to the store and someone made the mistake of walking a little close to me. You know, let's make sure we're respectful of each other. So we have to take care of each other in all of this. But I say, yeah, do what's best for you. And I think the businesses will those, and I would like to believe most are doing those things, putting those measures in place. That's been my observation. And for those who may be a little slower to come along, I think you have some options.
And I can also sort of piggyback on that and say, too, don't avoid going to the hospitals. I mean, if you have a condition, go to the hospital. If you're having some heart pain or if you're having an asthma attack that's not going away, I think one of the biggest things that we are seeing these days are people are avoiding the hospital because they think they're going to get COVID. More than likely, 9 times out of 10, you're never going to get COVID walking into a hospital. There are just so many things that are in place to make sure that you're being screened, making sure it's safe to go into the hospital. If you're having problems, go into the hospital. As the hospitals reopen, it's going to be very important, if you need to go, that you go. Don't avoid going to seeing your doctor or going to the emergency room because you think you're going to get COVID. We don't want you to have a serious sequela or serious problem because you didn't go to the hospital.
Okay, and I should say there's a comment here from Dr. Clyde Henderson, who's with the Cincinnati Medical Association. And he says, it is now clear that when people are wearing masks in public, it lessens the potential for the spread of coronavirus. So his question is, why is the governor's mask policy being driven by some people who are offended by having to wear a mask as opposed to policy driven by the proven science? So he's throwing that to Dr. McElroy. He wants it to be a policy.
So again, the governor is very good at listening and making thoughtful decisions. And he has stated that he heard from a variety of people. And there were many people who indicated that wearing a facial covering of any type would be problematic for them. And it is his belief, and he has shared that this is the decision that is responsible, in that we will continue to impress upon the retailers, the industries, what makes for a safe environment, continue to drive home the message to Ohioans of what is in place to protect you, and that this is the balance, and not to overreach beyond what he believes is the role of government. And I think that he has been a very good leader throughout this, and thoughtful, and listened to both sides of this, and has the best, I think, many of the best experts giving him great counsel. And this is a decision that he has made, and one that I believe that if responsibly, we can execute and still have success with this.
And some of it else is also somewhat subtle information that you have to pass out, because when the state of Ohio, when the governor of Ohio gets up before his speech, he has a mask on, he takes it off, he gives his speech, and he puts it back on before he exits, and he has people behind him that are 6 feet apart. We should do that the same way with our national leaders as well. Wearing a mask is not a sign of weakness. Wearing a mask conveys a sign of strength, and it's telling people subtly that it's okay. And I'm not a less of a person by wearing a mask. I'm actually a stronger person and sending out a strong message by wearing a mask.
Amen, Dr. Thomas. That is so true. Here's a question for Laura Mitchell. It's the question is, usually students forget a lot of information over the 3-month summer break, and they're referring to this as the summer slide. What's the plan to address the summer slide now that students will be out of the classroom for at least 5 months?
So our plan is to continue and extend learning through the summer. And so our plan is to be able to get out as many devices as we can over the summer months so that our kids can still engage with their teachers and continue learning. We're also focused on making sure that when our kids do return, and whatever that looks like, that our teachers will have to do a big review of what took place or was supposed to take place at the end of this school year, to make sure that we can catch all of our kids up. The other thing that we've really considered and talked about is this idea of focusing on competencies as opposed to seat time. So there are a required number of hours that a student has to be engaged in education throughout the school year, but looking at if kids have actually mastered a specific content, how we can move on into the next content area. And so there's a lot of work that is being done to be able to catch our kids up. We're very concerned that, quite honestly, that this could actually widen the gap for our kids in terms of our kids who have and those who don't have. And so it's our responsibility as our educators to make sure that we're able to catch kids up when they come back to school and not have an unrealistic expectation as to where kids are and what they may or may not have learned in these months that we were closed, while still having high expectations for our kids. So the short answer is, summer learning will continue, and we are also going to focus on that work that takes place in the first few weeks of the school year to catch them up as to where they left off before this all happened.
Thank you so much. Okay, here's a question. This must be for Director McElroy, and it says, how are barbershops and beauty salons being impacted by the partial opening order?
Thank you. Thank you for that question. So we have heard a lot from individuals within, who operate barbershops and salons, and there's certainly an eagerness to move forward. The governor has pulled together, as he has it with other things, individuals representative of those groups to advise him on how we move forward. And so I'm looking forward to how that is rolled out. So we are taking their advice, their expertise under advisement to understand the unique issues or challenges posed with that very up close one-on-one type of interaction. And so soon we will have something.
That's that's one of the biggest complaints I hear about is people not getting to their hair salons. People are like, oh, I need that hair done. So yeah, really.
Yeah, I feel the pain. I feel the pain. Now I feel all the pain.
My 17-year-old has started, my 17-year-old daughter has started to learn how to cut my hair. So,
right.
She may have a new sideline when she goes to college.
There you go.
It really means like we're in this together. This is the biggest. I think we're all in this part together. Yeah.
I know. Okay, so here's a question. This is interesting. It says, are using school buses an option for mobile Wi-Fi hotspots for CPS students?
It is an option. We've looked at a lot of different options. Quite honestly, we believe that all of our communities need to be able to have access to free Wi-Fi. So school buses are an option, but we're looking at what does transportation look like next year as well, and thinking about how we use buses and social distancing. We've also looked at having buses and trucks in specific areas in the neighborhood to be able to admit Wi-Fi for periods of time, which these are all great and creative ideas. The best thing, though, is for our kids to have access to Wi-Fi in their home. And we won't be satisfied until that happens, that all of our kids have that access. And so buses is definitely an option that we can consider.
Okay, thank you so much. And I should have said that question was from Brenda. So another question, so this goes to our doctors. When do I need a test for COVID-19?
That's a great question. Right now, if you are asymptomatic, there is no reason to go out of your way to get tested. Similarly, if you are mildly ill and you don't need to go see a doctor, and you just need some Tylenol and fluids and rest, I would say just isolate And I don't think you need to get tested in that setting either. At the point where people are sick enough to come to the hospital, as Dr. Thomas alluded to earlier, we're testing everybody, because at that point, we are not able to say, oh, well, this can't be COVID, it's only a headache, to use the example that Dr. Thomas gave earlier. Having said that, I think that there are also concerns about, I want to get back to Dr. Thomas's point about heart attacks and strokes not coming to the hospital. I'm actually very concerned. As I mentioned, I co-direct our stroke team, and our numbers have fallen off by about 50% from February through end of March. We're falling off to about 50% in terms of the number of people that are coming to the hospital. Does that mean strokes aren't happening? I don't think so. I think strokes are happening, unless COVID cured stroke. I think strokes are happening. People just aren't coming, in which case, I think we probably have an underlying public health crisis of strokes and heart attacks, and those numbers and data are being presented from different parts of the country with similar experiences right now. And so to go back to the original question, I would say you don't need to be tested just to be tested. If you're mildly ill, stay home and isolate. If you're ill enough and you come to the hospital, again, the hospital is a safe place. If you come in with concerns for COVID type symptoms, we will sort of, assuming that you're ill enough and potentially more infectious, will place you in a specific area of the emergency department, where again, you're separated and protected from other patients. And if we don't have classic COVID symptoms, we still test you.
Thank you so much. There are a lot of questions here about going to the ER, and I think that answers those.
And I just wanted to say that we're very lucky. Dr. Adeoye and I work at UC Health and University of Cincinnati, and have this great leadership with Dr. Rick Lofgren and Dean Andy Felak. And the patients, when you come into the door, we're going to ask everyone about their symptoms, if indeed they are symptomatic at all. And there are certain patients who do get tested. People go into surgery, people who are going to have C-sections or have a delivery. People who are donating kidneys, people who have certain types of cancer. So there are people who would definitely get tested, but those people who have mild symptoms should stay home and self-quarantine. Those types of things are still in play. But if you feel that you have an issue, you can always call your primary care provider and and they'll direct you if you have any questions.
Okay, thank you so much. Renee Mahaffey, I know you wanted to jump in on this one.
Yeah, I just wanted to jump in and say that my concern, and I appreciate all of the panelists, and I think there's some great responses, but there's still this concern about not really understanding if I go to the ER and maybe I'm not going to be responded to in the way that you think that you should. If we could have, if Dr. Thomas or Adeoye, if either of you could respond to kind of providing greater, understanding on what happens when you come to the hospital now. With the partial reopening, also how you contact your primary care or one of our public health clinics and get questions answered, because really what's happening is people aren't asking questions because they assume that they can't go to the hospital or they can't go to their doctor. And with the partial reopening, I think it would be really important for people to better understand what that means.
So I'll try and take the emergency department aspect of this, and then Dr. Thomas, if you don't mind, sort of going to one's doctor and those sorts of things. Again, working at UC, we see a lot of people, and what we try to do is ensure that everybody gets the most appropriate care for that person. So going back on my comments from a few minutes ago, in as much as if, without mincing words, my definition of how sick you are versus how you feel are very different things. And so when I get to a point where I feel like, you're not that sick, I really just want you to go home and isolate. And And so that assessment will happen in real time. And I think that overall, the emergency department, the hospital is a safe place. But in order for us to keep you safe, sometimes it is safer for you just to go home and isolate. And sort of trying to strike that balance can be challenging for all involved. And so I would just ask that you please realize as best you can that we're trying very hard to make sure everybody is getting the best care that they need. That doesn't necessarily mean we all get tested for everything that we want to get tested for.
Thank you for that.
Yeah, and I'd like to just from an ambulatory setting, you know, we're starting to ramp up in our clinics with patients that need our care, which includes OB, never stops. I mean, people get pregnant and you can imagine December, January, February, we're going to have a lot of pregnancies because people have been at home and there's only so much you can do at home. But we anticipate.
We're not even going to go there, Dr.
we anticipate we're going to have some babies coming in. But in general, when you come into you call and make your appointment at your primary care doctor, whether it's at UC Health or one of the other health systems in the city, or the Cincinnati Health Clinics, and we're connected with them. We are going to make sure that when you come in, you're going to get a mask. We're going to ask you questions. You're going to have your temperature taken. So we're doing all that we can at the front desk. They do it to me. I just can't walk in and say, I'm Mike Thomas. I'm the head of OB. They're going to say, so what? We're going to get your mask. You're going to get your temperature taken. We don't want you to be the vector. So it's very important that when you come to the clinic, you can feel safe, that everybody's being treated the same. If you need to be taken care of, you will be taken care of. Call and make your appointments. And when you walk in the door, we will get you in the right place. If you do have a fever or cough, we will direct you in the right way so that someone will get you taken care of. Don't have any fear about coming to the hospital. Don't have any fear about getting your a routine testing, coming in and being seen, whether you have an OB problem, a stroke problem, or any other issue, whether it's in the ambulatory, outpatient setting, or in the emergency room, or you've got to have surgery, you will be taken care of.
All right, thank you so much. You know, we have a lot of questions and just a few minutes left. So we're going to try to get through these kind of quickly. The next question is from Anna Garanzi, and she says, how do we work together to promote ongoing social distancing and use of masks? She says, I was out today for essential purposes and was frustrated by how many people were not following social distancing and not wearing masks, and clearly in groups of people, not from their own household. I worry for the most vulnerable that they have no choice but to work. I know we've talked about that. Does anybody want to add to it? I know Director McElroy, you talked about how we all have to be responsible.
Right. I think we will continue to be as transparent as we can be. And that's one of the things that I hope that people appreciate about our governor, is that he has directed us to be transparent with the data, with the information, what we have, where we're challenged, and so that people get a good picture of the reality of this. And so I think we'll continue to drive the messaging, and where we find pockets that we need to be more targeted in that messaging, we're going to do that as well. Just so people know, I mean, we have teams of people who focus on where we need to put our energy and efforts. And so messaging is certainly high on our list. And so we will continue to push those messages.
Okay, thank you. And so here's a comment to you. It's from someone anonymous, so they should have said their name because it's such a nice comment. To Director McElroy, you are doing an amazing job with the aging population in Ohio. You truly have a passion. Thank you for keeping the aging safe. So that's wonderful.
I appreciate that. And I did not pay anyone to do that, but thank you.
No one got paid. All right, and then here's another question for you. It says, what are Ohio colleges going to look like when the seniors attend in the fall semester? Is it safe for those college students to live on college campus during that time?
That's for me. I would say at this point, there's some things we just still don't know. I mean, the uncertainty, and we're continuing to look at the modeling. We're continuing to work with Dr. Acton and the teams and those who advise us from the colleges and universities. But at this moment, it would be premature to say.
Okay, thank you. Someone else asked, I heard there are two different strands of COVID-19, strand L and strand S. Strand L coming from Europe is worse, and that's what hit New York. Strand S from China is milder, and that hit the West Coast. Could it be the Cincinnati got the milder West Coast version? I hadn't heard about strand S and strand L. Doctors, can you tell us about that?
I have not heard about strand S and strand L either. There are multiple coronaviruses for context. They've been around for a while. This particular one is the SARS coronavirus. It's a second SARS coronavirus. We all remember SARS from about almost a decade ago now.
Right.
But as far as the different strands of the SARS coronavirus type 2, I do not know about that, honestly.
Yeah, I've not heard of any differential in that way between an L and an S. But I think that all the viruses are the same. It probably depends on, again, if you live in a more dense populated area, you're going to have more symptoms. And I think that has more to do with it than any strands per se. I think, in California, you see it in Detroit. You also see it in New York and these more densely populated areas. I think that has more to do with what happened in those areas than any type of strand or type of virus.
Okay, great, thank you. Here's a question from Reese Morgan, and she said it's for all the panelists, so anyone can answer it. What do you think about the low numbers we are seeing in the pediatric population? Are they carriers? I think we've already heard that young people are carriers, or everybody can be a carrier, right? So
I think in people under the age of 50, especially under the age of 30, I should say, there's less immunity, because once you get kids around, they give each other viruses back and forth, and that was the original thought, is that they have these viruses and they develop this immunity, and that immunity probably carries up to the age of 30 or so, which is why it was thought from the beginning that those folks would not be as affected. And that seems to be true, because you're still carrying your childhood immunity with you. And then as you get further and further away from that childhood immunity, it really starts to become more and more of a problem. And then as you get these comorbidities, obesity, diabetes, hypertension, that those folks then suffer the biggest and worst part of it. And you see that a lot in these communities of color.
Okay, thank you. Here's a question from EZ, and it says, I'm sorry, from EZ Connect. Okay, our EZ Connect. Okay, great name. Okay, has this experience taught you anything about the resiliency of the health system and the education system? And I'm going to tie this in with another question that says, is the health system overwhelmed? So just tell us globally about that.
Again, I'll take a first stab at it, Dr. Thomas, from a health system point of view, and obviously defer to Ms. Mitchell on the education system. I would say right now in Ohio, and a lot of that goes back to sort of the governor's plans and how well Ohio has sort of flattened the curve to some extent. I would say right now the health systems in Ohio are not overwhelmed, and the good thing also with the experience that we've had and with the anticipation that everyone was having based on the Seattle and New York experience is that UC Health and I think other health systems in town are prepared. We have plans in place, we have things laid out, we can flex up and down, we can turn it on, and so as we can turn it off. And so as much as it is not ideal, if we get hit, we are set up right now, and what we've had is a practice run, and that practice run has very well positioned us should we get a surge as we open the state back up. The health systems in Ohio, UC Health particularly, I believe is well prepared.
And I could just sort of add to that from a medical standpoint, in that the leaderships of all the hospital systems. I know from UC Health, and I know that they've been collaborative with TriHealth, Mercy, Christ Hospital, St. Elizabeth's, all the hospital systems in the area have worked together to make sure that they've had their surge planning within their hospitals, and then working together on how to deploy patients and how to deploy nurses and doctors within those systems. And I think I also need to point out, when we talk about the heroes, the medical staff folks as heroes, the nurses and doctors, but we also have to let people know that our environmental services people, our reception people, they're also part of this. We are all working hand to hand in this, and our environmental services and reception folks, medical assistants, are just as important in this equation as the doctors and nurses.
Okay, thank you so much. I was going to say we're almost at the 5 o'clock mark. I see our other panelists are arriving. So let me just respond to the attendees. So Lauren Morris, you're asking about switching schools and learning from home. I just want to let you know our next panel is going to focus solely on education. So if you could hold that question, we're going to talk about that in just 2 or 3 minutes. Victoria Hayes mentioned that non-emergency medical transportation providers need more PPE supplies. Victoria says they're getting harder and harder to locate, even online. Also, there's all that price gouging where they go from reasonable price and suddenly everybody's trying to make a profit. So she wants suggestions about that. So we're going to ask people to respond on Facebook or to respond to the website covid19communityresources.com. We do need to hear more about the PPE supplies. And then another attendee mentioned the Ambrose Clinic in Avondale. It's right there next to Carmel Presbyterian and across from Southern Baptist on Reading Road. And they're saying it has primary care for patients who can get evaluated for COVID and develop a primary care relationship. And I want to just mention that there's 6 Cincinnati health clinics around the city. Also, as you know, CEAI opened a flu clinic, which tests for COVID as well. You can drive through or you can walk in. Dr. Keith Melvin is heading up that clinic. Kroger has done some pop-up clinics. They did one at the Dunham Recreation Center, and I know the Health Gap is working with them on some other pop-up clinics. And I should mention Governor DeWine, and so thank you, Director McElroy has talked about increasing testing across the state, and that's about to happen. So there's more testing coming, which is really so important for all of us. But I hate to end because all of you are so wonderful and you have so much information. We are going to have to go straight into our second panel. So I just want to thank all of you. If anyone still has a question unanswered, please go to covid19communityresources.com. You can even ask a doctor. There's a special section on there, and there's information about education and jobs and unemployment and everything. So I want to thank all of our wonderful panelists. Thank you so much. You're just doing such a great job. Thank you not just for being here today, but all that you're doing for our children, our adults, our families, our city, our state. We really, really appreciate you. I know you're all working so hard. I hope you're taking care of yourselves because you're taking care of all of us. So thank you so much for being here. We really appreciate you.
Thank you.
Okay, attendees.
Thank you.
Thank you so much. Thank you. And there was a question too for Dr. McElroy. So I was just going to say we're going to get to that on another panel, but it's talking about the Minority Health Strike Force. So just know that we saw that, and we will get a report on that. Renee's on that strike force as well. Vice Mayor Christopher Smitherman, Dr. Odell Owens from Interact for Health. So we're talking about getting some information on that. So I'm not ignoring your question. We will get to that soon. Okay. But now we are going into segment number 2, and I see our panelists are here. So glad to see all of you. So this is session 2 of the COVID-19 communityresources.com town hall meeting powered by the Center for Closing the Health Gap. I'm still your Cincinnati City Council person, Jan-Michele Kearney, and I will still continue as your moderator. So as with the first session, you may ask your question directly on Zoom or text it in the chat room on Facebook. I just want to remind you again that this session is being recorded so that we can broadcast it later. So now we're going to delve a little deeper into education and how we're continuing education at home. It's a whole new model. In this session, we're going to talk about preschool through high school. If you have questions about college, feel free to ask. And let me introduce our wonderful panelists. So panelists, just kind of wave so that everybody knows who you are. So we have Winton Woods Superintendent Anthony Smith. And Mr. Smith, I don't see your video up, so I don't know if it's just my screen, but I know you're on because your name is up. So we're gonna work on getting Mr. Smith's video up. We have Cincinnati Deputy Superintendent Tianay Amat. We have former school CPS board member and senior vice president of the Urban League of Greater Southwestern Ohio, Vanessa White. Vanessa Wave, okay. We have educator and homeschooling expert, Larry B. Hodge. I bet your phone is ringing off the hook now. Parents are like, what do I do? Okay. We have early childhood educator and director of the Nannies Daycare Centers, Brenda Harris.
Hi, everybody.
Hey. And then we have Dean of Students at Purcell Marion High School, Janetta Johnson. Hey. And Janetta and I had a great talk earlier. She had some great answers. So a lot going on. Before we start with questions, I would like for each of the panelists just to make a few intro remarks. We already have questions that have started. So here we go. Let's start with Mr. Smith. Can you hear us? Okay, we're going to come back to Mr. Anthony Smith. I see his name up here, but there's some tech thing going on. We'll straighten that out. We're all going to be tech experts.
Okay, can you see me now?
Okay. There you are. Okay.
All right, very good.
Smith, would you like to make a few intro remarks?
Yes, ma'am. First of all, thank you for having this segment. I think this is absolutely amazing, and I will be short and brief and to the point. For all students out there in every community, not just Winton Woods, Cincinnati Public, Finneytown, Fort, Northwest, any of them, if you have not reached out to your teachers and to your administrators, I know they're looking for you. They're trying to connect with you. So if you have not made contact with your teachers or your administrators, please make sure you do that because they need to make sure they connect with you. Regarding how to keep you focused on education and opportunities. All right, thank you.
Thank you so much. Okay, Cincinnati Public Schools Deputy Superintendent Tianay Amat.
Good evening. I'm so excited to be here and thank you for having this event. We're not going to get through this in silos. So this is an opportunity for us to come together, share ideas, support each other across different functions. And I'm with Mr. Smith. Our greatest resources are our teachers. So students make contact. Our teachers are making contact with students. And this right here is very important because this is about the community and parents as well. And at home, they need the support. They are now teachers and educators. So what can we do? So although I'm here as a panelist, I'm also here to listen, to see what the needs are so we can go back and provide that service. So thank you for having me.
Thank you so much. Okay. Former CPS school board member and senior vice president of the Urban League of Greater Southwestern Ohio, Vanessa White.
Hi, and I just want to reiterate because I've been told I'm too humble. I'm actually Dr. Vanessa White, and I spent. Everybody just keeps getting on me, but the reason I say that is because today is the year since I graduated, and it's been interesting to reflect on the learning because sometimes you go through it and you don't really think about all you've learned. But my degree was specialty in educational policy, and I embarked in that route because I had a criminal justice degree and then an MBA, but it was really through my parenting experience when I saw how differently education had become from when I was growing up. And so right now it's 3 generations in my house. Fortunately, my grandchildren are here, and I've really been able to reflect on the village that is created here And I have college students who are about to graduate, one next week and one the week after, and being able to really support. And I just want to echo what Deputy Superintendent said, is that what this pandemic is showing us is that we're going to have to go back to some old school stuff, and that we can no longer be comfortable as the community, as grandparents, parents, and nonprofits and institutions to believe that we don't have a role to play in making sure that our students are successful. And hopefully we'll talk more about that as we go along.
Thank you so much. And I should say, Eric Kearney sent the message. He said, "You earned that PhD, shout about it." Okay. All right, that's great. Okay, and next, educator and homeschooling expert, Larry B. Hodge.
Thank you. I appreciate the opportunity to sit with you all and talk about this afternoon. As everybody knows, we got a lot of parents that are extremely concerned about their students. I actually am the CEO and owner of Hodge-EDU, and that's where we actually believe that education is what empowers their dreams. I do that in about 3 ways. The first main way I actually help students is I help them with the understanding of math and science. I'm actually rolling out a MEL program for elementary school students to really raise the proficiency in math for our not underachieving, but students who are struggling with that subject. Then I work with students who have to take the ACT test. And then I work closely with teachers and parents. We coach and consult them on how to navigate through the educational process. So I'm excited to be here. Thank you all for inviting me.
And I was going to say, Mr. Hodge, that Eddie Cohen, President and CEO of the Urban League, said that you were on one of their panels and you were just so outstanding and so popular. And so Vanessa White told us, we've got to have you on this panel. So we're really excited to have you here. Thank you so much. Okay, Brenda Harris, early childhood educator and director of the Nannies Daycare Centers.
Hello, everybody. Thank you for having me. My name is Brenda Harris with Nannies Multi-Level Learning Center, and we serve children from 18 months to 5 years old, to be just before they go to kindergarten. So we really start the process at 2 years old rather than 3 years old. So that's our business we have been in business for 47 years, and we're located in Avondale, where 95% of our kids are African American.
Wow, 47 years, that's fantastic.
Yes.
All right, yes. All right, Dean of Students at Purcell Marian High School, Janetta Johnson.
Hello there, thanks for having me. First of all, I was so nervous. I did call Ms. Jan earlier, like, I don't think I am the person for this panel, but looking at the website, and I'm like, I never heard anything about it. And listen to Ms. Vanessa saying being comfortable. I was comfortable in my little corner of Purcell Marian, so that's all I knew. And I know my mom used to tell me sometimes when you're comfortable, you're not growing. So I'm so glad to be a part of this, to learn more and to give what I have to share about the Purcell Marian community. I actually graduated from Purcell as well, where the dynamic and the culture has totally changed, where when I was there, it might have been 10 to 20% African American, which now is like 70% African American student body. So I'm glad to be a part of. Thanks for having me.
Thank you so much. Let me just address Mr. Smith. Now, Mr. Smith, if you don't want your camera on, it's okay. But Dr. Robin Ford is saying you can start your video when you're ready, and you locate. Oh, and Larry's telling us you can locate the camera.
Oh, there he is.
Oh, you're here.
There I am.
There you are.
I was waiting
Right.
for this second.
Thank you, everybody, for helping. Okay, good. All right, so we're gonna start questions. So let me start with Lauren Morris, because she's had this question up here since the last panel. So Lauren, we're gonna do yours first. And your question, you said you were already planning on switching your daughter to a different school before this, but if we're going to continue learning from home, does it matter? So educators, and I don't know from what school to what school, but educators, what do you think? I guess the real issue is if we're all doing, home school learning or home learning.
Mm-hmm.
Yeah, I can jump in. So I like to say, first off, the learning at home definitely needs to continue. This is an opportunity. Obviously, this pandemic has caused a lot of our parents to be burdened with something else to worry about. You know, obviously we have to feed our kids and we got to haul them off to school, make sure they get after school programs. But what this actually, one good thing that's come out of this whole thing is looking at and evaluating our student, actually looking at your child and evaluating them as a student. So now you get to operate and see how they actually process some of the things that they learn. I'm not a big fan of saying, you know, if you leave this school and go to this school, you're automatically going to be successful. We understand that the success is going to come or be motivated from within. So this is an opportunity for, you know, all of our parents to, before we actually make that switch, or even in conjunction with the switch, just ask the question, you know, how is my child as a student? And then once you figure that out, you might notice that they learn a certain way, they process things a certain way, and then that can also assist with the homeschooling process, which needs to continue to happen. Just because you go from one building to another building, that doesn't mean that you won't be promoted from one grade to another grade. And so we want to make sure that they're constantly abreast of what it is that they need to learn for their grade level. And we want them to be performers wherever they go, you know, because this is going to follow them for the rest of their life.
Right. Okay. Thank you so much. Here's a question. Anyone can actually answer this. It's addressed to Anthony Smith, Tianay, Amat, and Janetta Johnson. It says, what are the schools doing to ensure that our kids aren't falling behind?
Okay, excellent question, by the way. One of the things that I think a lot of schools are doing, I know that people have decided to do a lot of remote work using Chromebooks, using technology of any sort. And I think what happens is the consistency of making sure that the students follow through on the assignments, get back with the teachers. And I think the other part that makes it so relevant for us and for any educator is how well the teacher is communicating with the student. You know, is there feedback? Are you giving me feedback about what I'm doing or what I'm accomplishing? And is the feedback relevant to my assignments? You know, attendance is not a factor anymore because everybody's present at this point. So at least we conquered that hurdle. But I think one of the things that makes it so amazing is how do you reach into a kid's spirit, keep them engaged into the educational opportunities, and make sure that they don't fall further behind. So I know that Tianay mentioned in the beginning, what we've done in the past is not going to work. We have to do something different. We have to be very, very transparent about what we're going to do with our nation's youth. And I think the other part that's going to make it so relevant for us is how do you make education relevant so that whatever I'm putting in front of you, I can use it as a tool to understand content and move forward. And then finally, school's been shortened. School's been shortened. The traditional experience of what we do at school is not there anymore. And so using the flavor of understanding these virtual experiences, kids have to get adapted to it. But I think one of the things that we don't want to forget is teachers are getting adapted to the virtual experience as well. I know at Winton Woods, we have the opportunity because we're a project-based learning institution, and we've been working remotely for long periods of time. However, not for months at a time. It's usually days at a time. So this is absolutely different for us as well. And I think one of the most important parts that we have to do is we have to open up the communication lines and make sure that parents are communicating with teachers and vice versa.
Okay, thank you so much. So the next question is for Ms. Harris, and it says, a big part of getting ready for school is social skills. I only have one child. Since we're isolated right now, how can I help her learn to play with other children?
That's going to be tough with social distancing, and that's one of the things that we are concerned about when everything opens up and when we do go back to school. The problem is social distancing is going to be the norm, I think, especially with people having to wear masks and protect themselves. So I don't have the answer to that if you only have one child. I guess using a tool like Zoom or being able to FaceTime with friends, reaching out to their classmates if they've been in preschool. And the daycare centers can certainly provide with parents permission to share phone numbers so that they can have a virtual play date together. So I think that would probably be a safe way to be able to interact with other children.
I think those are all excellent answers. I think one thing this pandemic has shown us is that we need to all get tech savvy. Those of us who are tech savvy are like ahead of the curve. The rest of us have to catch up because technology is so important. Virtual play dates, we've heard of virtual weddings, virtual funerals. I mean, a lot of it's virtual now because we have to do social distancing, and then virtual learning. So Ms. Amat, did you want to weigh in on the whole virtual learning part of this?
Absolutely. This COVID-19 has just shook the ground for us. So we have to be innovative. We are taking multiple approaches because kids learn differently, their context is different. So we're doing things from learning packets to Schoology, Zoom, Google Meet. We also have a website where you can log on, see lessons. We just launched 2 weeks ago, CPS TV. So you can go on and see your teachers teaching, engaging. We have fine arts lessons, yoga classes. We also want to take the opportunity to speak with parents during this time. So we're just trying to close the digital divide as much as possible. Just this week alone, we distributed 1,700 iPads to students. So we're just trying to hit it from all angles. Just as Mr. Smith said, this is new for a lot of our teachers. So we're taking this opportunity to do professional development on content standards. We're taking this opportunity to do professional development with our principals to go and observe virtual classrooms to give teachers feedback and to support them. So it's just a new way of teaching and learning. So although it's different, I think it's about time that we meet the needs of all of our kids.
Fantastic. This next question is from Mr. Hodge, and it says, do you have some tips on homeschooling? My children sleep late and they stay up late watching TV. Okay, what parent hasn't made this complaint? Okay, my children sleep late and stay up late watching TV and playing games on their phones with their friends. Should I have them on a schedule?
The short answer to that question is yes. For health reasons first. What you got to understand is when our students go to school on a daily basis, they actually have a trained muscle to wake up. They're ready to receive information from a certain time to a certain time. They're ready to receive information, ready to receive food at a certain time, then they're ready to receive more information, then they come home. The best thing that you can do at the time like this is try to create some aspect of normalcy. Obviously, it's not going to be what it was a couple of months ago, but you do have the opportunity to create a certain space in your home or create a time where you're going to learn, and then create a pace and then open up the dialogue. Maybe it's an opportunity for you as a parent and your child, set a certain pace. This is what we're going to accomplish this week. This is what we want to get done. This is what we want to turn in. As far as having a set bedtime and having that away time from screen activities, multiple studies have shown that it's not healthy. But what I do want to point out is this: if they do have the opportunity to utilize the screen to do fun things, then that should really eat up any excuses as to why they can't get on and check Schoology or Power School or any of the communications from their teachers. So as a parent, we got to keep all these tools in our belt when our students and our kids give us these excuses as to why they can't get ahead.
Right. There you go.
Can I add something to that? Yeah. As a parent who has raised 5 children and just plays an active role, I think what this has also given us an opportunity to see what our role is to play as parents. And I think some of the differences, even when you think about a school day and how much testing and policies and all that kind of stuff is played into how we compress learning into a school day. And what we have now is an opportunity to spread that out. And similar to what early child care centers do, is this a longer school day, children can take naps. And so now you have the ability to give kids some of the stuff that a traditional education had pushed out of the way, like recess. We complain a lot about recess. We don't have it. Now you can take a break and take your kids out. And I've seen Facebook posts of chalk on the thing. You know, I'm going back to some of the traditional things at Jacks. Think about how parents used to play Jacks. Jacks was all about math. And so some of the things that I'm starting to do again that are fun, we can start to do that as parents and see our role in our ability to stretch that learning out all summer, because we have a role to play in Summer Slide as well. And so do our grandparents, our community. And I think we need to seize this opportunity. You know, as Larry was saying before, something that we have to look at, what are the opportunities here from COVID-19? And one of them is to completely look at the lack of the inequities that, you know, the system has created, and how we begin to re-envision and reinvent what education can be. And I'm a big, huge advocate in the role that parents and community play.
That's fantastic. Yeah, I was really good at Jacks when I was in 6th grade.
I know. I had a ball. Paddle ball. Get that paddle ball.
Tianay was too. Yeah.
Yeah.
Okay, that's great. Okay, so here's this question is for Janetta Johnson. This is kind of a rough one. Were the schools prepared for this pandemic? And then follow up to that is, what can we do next time?
I have to say, for Purcell Marion, I can only speak for it because that's the school I'm in. Our principal actually was on top of it. We wasn't perfect, but we definitely were prepared. The day that our governor came out to say that the schools would be closing, we were actually on spring break that following week. And our principal actually had started meeting with myself and the vice principal that Monday or Tuesday of that week, and said, we need to start putting some stuff in place, because I do believe that the schools are about to close. And myself, I'm like, no, it will never close the schools. And he said, no, we just have to go ahead and get some stuff in plan just in case something may happen. Let's look at it. Let's start taking a survey with our students to see who all has the internet, who does not have the internet, and we can kind of go from there. All of our students are issued a personal laptop for the entire school year. So our spring break actually became a working spring break. We had all school professional development for the teachers. We actually had meetings almost every day after school to kind of lead up to, this is what it may be if the governor shuts the schools down, and this is what we're looking towards. I have to say, like I said, we're not perfect, but we definitely were prepared. Myself, I thought I knew something about technology until it was time for me to start doing some things. Not only my dean of students, I still teach a couple of classes, which I love, but man, I'm telling you, I was like, oh my Lord, I'm pretty ignorant when it comes to doing a lot of this stuff. And the students are like, Ms. Johnson, click on this and click on that. So I have to say, he did prepare us. We still work with each other because there is a learning, there's something to learn every single day with this. We have a lot of supports at our school as well. So we have a couple different programs in our building that helps our students. Beach Acres. A few of our students did not have the internet. They stepped straight in, called the different places, and were able to get our kids with internet access. We have our SICE program, which stands for our Catholic Inner City Schools Education. They're there. They have a full-time nurse, also social workers that can help our parents along with our students. We have our MUST program, which is there. Just a lot of support to help our students whose needs outweigh their resources. And they're there to kind of really reach out to those students. So as the school year goes, talking to the principal, we're going to meet, especially with our core classes, such as our English and math, and see what we can do for our students during the summer. And if this thing continues for the next fall, what it looks like going into that, and what tools and resources we can use for our teachers to even enhance this learning curve. Our students must report to their teachers every single day. So the accountability really is there. I do attendance after every single class. Students that do not attend, there's a notification that goes out to those parents, and we're in contact with the parents and those students behind that. So we're trying to do everything we can to make sure that those kids are engaged. We do have a few that do not like it, and they just, I don't want to call it like a depression, but they need that social interaction with those students. So we're doing everything we can to kind of help those kids come on board as well. So like I said, we weren't perfect, but I do believe that we were prepared for it.
That's fantastic. Mr. Smith, this connectivity keeps coming up. How's Winton Woods in terms of the families having internet? I know that in the in some neighborhoods here, that's an issue.
Yes, thank you, Ms. Kearney. One of the things that we had done early on, like some of the other districts, we are connected with Sprint. And Sprint, we had a Sprint connection for several years. And Sprint was able to expand the connection, not just for high schools, but from grades 2 through 12. So we've issued Chromebooks and technology for students in grades 2 through 12. The parents are excited about it. You know, a lot of districts have talked about the packets, but the packets became complicated because you had to get the packets back. People were concerned about COVID and how long the packets should be in isolation. And so the Chromebooks actually become a better opportunity for students. And I think what happens with that, students can get more immediate feedback as opposed to teachers collecting the packets. Then you have to grade them, then you have to get back to the students. And I think it became very cumbersome. Students are already in a mobile situation where they can't be with their peers. They're in isolation. So creating more isolation was more of a storm for us. And now that they have the Chromebooks, they can actually communicate with their peers. They can have social conversations. They can still work on their group projects. But the other part that I think I'd like to really touch on is, you know, we have a lot of kids that are part of clubs and organizations. Those are social entities that are very, very important for schools to keep moving forward. You have bands, you have choirs, you have orchestras. And I think that one of the things that we're going to do next week when we are talking about students picking up their belongings as well as teachers, we're going to get those instruments to those children so they could still have some social consciousness because these instruments help me get to college. They help me with scholarships and opportunities. And for anybody out there who is a musician, who has participated in anything with groups, sometimes you need the comfort of the instrument to help you get through the day.
Very good. I was going to say, Ms. Amat, I understand that CPS has a one-to-one, one child per computer program for 4th through 12th grade. And so a lot of the computers that are there in the school were sent home with the children, but then the connectivity is an issue.
Yes.
And it sounds like CPS is working on that, but that's a tough one because if kids don't have internet. So do you want to comment on that at all?
Sure. It's something that we are still struggling with. We have sent out information. Spectrum had free service, so we gave that information out, but there was a wait to even get that service with a lot of our families. We also gave, it's called a Kajit, where it's like a mobile hotspot that we have given out to our families. But I want to take this opportunity to say, to go back to kind of were we prepared? The first thing that we did was look at 2 areas. One is the basic needs of kids being met. So we did not skip a beat when delivering and distributing meals for kids. I think that is important. We try to have this sense of belonging as tough as it was with social distancing and having our teachers reach out to families. I'm in agreement with Mr. Smith with music. We just it was Thursday night, we had concert on the couch where kids through social media that parents and families and the community can log on and watch our kids perform. So those connected ways, but also taking care of the basic needs, because that's what our parents are facing right now. And then once we were able to ensure that those practices, those systems were in place, then we went into, okay, here's the learning package. Here are the devices. Here's how you can access Schoology. We have a hotline, 363-0123. Please call us, families and parents, if you need support, any questions that you have to have answered. You will have a live person on the line. Those basic needs are important. And I just want to tell our families that they're doing a tremendous job, to take a deep breath. We are here and we're in this together.
That is wonderful. And you know, you make a really good point, because basic necessities like meals are so important, and a lot of our families, our children depend on the schools for meals. So when schools are closed, it's like, oh my goodness. And CPS jumped right in there with opening up the different centers where students could come and get breakfast, lunch, and dinner. So we really, really appreciate that. That's huge. Thank you so much. So, all right, so another question, and there's several coming up here. So one is, what can I do to make sure my son doesn't fall behind during this remote learning period?
I'll jump in. One of the things that a person can do to really make sure that their student does not fall behind is, and this is a good learning opportunity, the Ohio Department of Education does a very good job of outlining specific benchmarks broken down by subject area that a student has to understand before the end of the year. If you have a student and you kind of see where they are in their current grade, a beautiful thing to do would be to look at the next year's grades. Maybe actually try to locate or hunt down some work that goes over those standards. Try to find old textbooks on the internet that might cover the objectives that are going to be covered in the next year. So that instead of the person waiting until the teacher actually presents the information when they get to school, they can already work on it during the summer if they have some spare time. I tell my students all the time, as somebody mentioned summer slide earlier, your brain has to continue to do something in that area. It doesn't have to be the same, but you got to do a little bit all the time in order for you to keep sharpening that tool that we call our mind in different areas, especially math, and reading, because these are these things that you don't just wake up and say, I'm going to do this, but then you can also get creative with it. You can build it into your daily life. You can build it into recipes. You can put it in activities that are around the house. So we want to make sure that we're being intentional, not just teaching students knowledge, but actually making sure that it's going to be aligned with the benchmarks that Ohio Department of Education puts out.
And, you know, I'm really glad you mentioned a summer slide. We brought that up in the last panel, and I said we'd bring it up again here. And the question in the last panel about summer slide was usually students forget a lot of information over the 3-month summer break, and that's what we call summer slide. What's the plan to address this now that they'll be out of the classroom for at least 5 months? Would anyone like to talk about that?
I'd like to make a comment about the younger children. I think that if parents take the time to read every day and read books with certain themes, you can read books about numbers, you can read books that focus on the alphabet and learning 3-letter words for the younger children, having them help cook and measure out recipes. Just in conversations, it doesn't always have to be so structured for younger children. It can be relaxed, but it can be intentional teaching. So I think at the end of this, parents will feel empowered to do these things, because when parents rely on teachers to do the teaching, they kind of don't think that they're capable of doing it. But I think during this time, they're going to learn how powerful they are, what a big influence they can be on their children's learning.
I think that's a really good point, because a few of the questions that we had were about parents feeling like they really weren't capable of teaching their children. Some of them said, you know, my level of math is 4th grade, and, you know, my kid's in 7th grade. I don't know what he's asking me, you know, what she's trying to do. So what advice for those parents who feel like, you know, I don't know the answer. I'm not doing calculus. How do I help my child?
I would say hold us accountable. Our teachers have office hours. If you go on our website, you can plug in that I request a return call from a teacher. Our teachers are available. They want to help. So it's okay to ask for help. And that's where I think the block is, that it's not okay. We want to help. We have to do this together. We don't expect, I couldn't do a calculus class. I told my own personal kids after 5th grade, pay attention. I can't help you with your math homework after that. So definitely have developed those relationships, hold the schools accountable, reach out to the teachers. I know CPS, we just have a variety of platforms, whether it's telephone, like I said, office hours, the helpline, website, a variety of ways that we're asking families to reach out, but we're also expecting our teachers to reach out home. But that's a tough one.
Yeah.
Can I add something to that?
Vanessa, hold on 1 second. I just wanted to get the number for that hotline again.
Okay, sure.
Do you mind giving us that number again? Vanessa, we'll come to you.
363-0123.
Okay. All right, 363-0123. Okay. And we're going to make sure that's on our COVID-19 communityresources.com website too. Okay.
And Jan-Michele, can I give you our website? It's a one-stop shop website. It's remote-learning.cps-k12.org.
Okay.
Thank you so much.
Okay, remote-learning.cps.k12.
Dash is CPS
dash. CPS dash. Okay. All right. We will have that as well. Closing the Health Gap is collecting all this information. They're going to put it on the website.
That's
and
great.
We can actually link to the CPS website. So that way it's really easy to get to in case you're like me and you forgot the dashes or the periods there. We'll get you there. We'll get
Thank you.
Okay, Vanessa White.
Yeah, I just really wanted to add that all of these are options. And I also want to make sure that we understand that it's okay. You know, I couldn't do stats. What am I doing? I couldn't do stats, my stats class, and I still have a relationship with one of my Walnut Hills graduate friends from whatever, and she was a pro. And so we would sit on the phone and she would walk me through stuff. So there's other people. Am I getting static? Playback?
Yeah, you're echoing, but we can still hear you though.
Okay. So so we can also reach out to other people. It's just like Mr. Smith mentioned. So friends are helping friends. You know, we can still do that. There's still other avenues. The teacher has office hours, but we did study groups. So it's just really pulling back on some of the old ways that we used to do stuff and not keep thinking we're in this alone. My daughter would tutor her same age peer in Latin. Is who wants to learn? I mean, some of this stuff is not easy. And so I think it's okay to really keep thinking about how we extend the village and not be ashamed. For any parent, no shame, because we have got to go back to some old school principles and stop feeling like we're inadequate, because every parent, the one thing I have always known is every parent I've ever met wanted the same thing for their child and for them to have a quality education. And so whatever we have to do to support each other, this is the time to rethink how we our community and how our village needs to extend. And the whole disparity piece, and I'll just say this one more thing about this pandemic, the disparities were already there. Mm-hmm. The pandemic is just putting shining a light on them, and that we also are going to have to think about, you know, in the future, how we think about the supports that were in place. What I'm listening to is 3 different systems. A small size, a Catholic inner city system. My brother is a graduate of DeSales. A smaller school district and a very large school district, all with different capabilities that don't seem fair. You know, the district's struggling to get capacity out. Everybody else has it. We need individualized learning plans for each and every one of our children. Each and every parent should have that. And that's what is fair, so that if this happens again, we're not concerned about who doesn't have a laptop and who doesn't have proximity to get internet service and who doesn't. We need to learn from this and start to advocate for the things that our children need as individuals and the things our families deserve. The Black community and the disparities that have been highlighted are impact. And if we don't take advantage of this opportunity to do that as a community, and same with the preschool, which is why we advocated for equities in preschool. I'm hearing that, you know, what's happening with Black centers, Black-owned centers, is different than what's happening with larger, you know, white centers. And all of this is something that we will have to own and address.
I love that. And you know, the thing is, we keep saying we're going to come out of this even better on the other side. And so this is, this pandemic has highlighted some of the issues we already knew existed, but it's making us realize, you know, it's bigger than we thought, and now they've been magnified. And so we're going to come out better. I want to say Dr. Robin Ford reminded me of what Ms. Amat was saying. Remote, here's the website. It's what is being sent to me, what Dr. Ford is sending. remotelearning.cps-k12.org. Is that right, Ms. Amat? Okay. remotelearning.cps-k12.org. Okay, so that is the CPS website, but again, we will have that all for you. So thank you very much. Here's a question, and this kind of goes with, well, there are two, but let me go with this one first. And this goes with what we've been saying about resources. And the question is, let's see who asked me this. It's where, oh, it's anonymous. Okay, all right. Where can I find online resources to help enhance math, science, etc.? Where's a good place to find online resources? And everybody can just maybe tell us your favorite places to go. I know there are lots of them.
I kind
I
of
would
like,
say,
oh, go ahead. Go ahead.
I'm sorry.
Okay.
I would say Larry Hogue, we actually partnered with his company, and he is a valuable resource. He cares about the kids, not just the academic side, but he also cares about the social emotional piece of it. Because think about it, guys, some content is actually overwhelming. And so now you're in this COVID situation where you are isolated from friends, and now you're being impacted with content that was already overwhelming you before you were even in this situation. So what we have to do so that kids don't run away from education, we have to create a plan where we become the affluent society and not the society that's going to dumb down or water down education and move kids through. Because at some point in time, they will be caught. The system will put them in a compromising position where they will not be able to move forward. So one of the things that we have to do is we must make sure that all of the parents and all the students are getting every resource that we can touch. And we have to put it out there on social media. Here's a way to do it. Here's another way to do it. I think there are 1,000 different ways. And I think that Cincinnati Public has some great resources and some opportunities. But I think one of the pieces that makes us whole is how do we make sure that we create this level of equity? How do we make sure that every kid gets a resource, and that resource is something that's not just going to be temporary? So in Winton Woods, we have a summer school team that's already working on a summer school plan. We also have a reopening school team. What's the plan to reopen school? What's going to be the social distancing rule? And for the students who have some serious gaps in their learning, we're also talking about Saturday opportunities right now, because we have to figure out how to give them more when in fact we have never experienced a 5-month layoff of school. And I'm not sure what district has, but Winton Woods has never had a 5-month hiatus from school. So we have to figure out how to make up that time, but we have to do it with a level of fidelity where we're not overwhelming our students.
That is so true. And, you know, I just wanted to point out too, there are a lot of online resources from the colleges that are free. For example, Harvard University is offering free online classes for students and parents. So if you want to go to Harvard, now's the time to go because it's free. So look for free Harvard online, and you can sign up for classes, and, you know, that'll be great. So thank you for that, Dr. Smith. Really appreciate it. Did anyone else want to comment about some online resources? Okay, because since I mentioned Harvard, let's talk about college. All right, so the next question is, how will this time period impact my child's chances of gaining admittance into college? And this goes back to, I guess, being, you know, falling behind, and, you know, what are we going to do about this? So does anybody want to comment on the whole college issue? I know some parents are really nervous about that now.
Yeah, I've been noticing that a lot of colleges are relaxing their ACT and SAT requirements. And this might be a conversation that we will have on a different level. I'm not sure if it's going to really prove as an advantage for our students. It's not because I want to keep making sure that people take ACT because that is its own company and they're going to figure out ways to do their own business model. But really what we want to understand is that, you know, we want to make sure our students get the best college experience. And what I mean by that is we want our students to actually be on main campus, to move away from their environment that they were in so that they won't have the barriers that we're talking about right now. They live on campus in a dormitory. 9 times out of 10, there's going to be some type of curfew. They're going to be fed. They're going to have access to teachers and assistants, office hours, and things of that nature. But, you know, a lot of colleges, really to answer your question, it really depends on how the time is being used right now. Are they continuing in their learning? Are they practicing for their college entrance exams? Are they reaching out and utilizing resources? ACT gives resources. I'm a resource. There are other resources around the city. Are they really making sure that they're putting themselves in a position for when the test will come? We know that the next ACT test is in June. We know the SAT canceled their test in June, but they're going to have one probably before they go back to school. So what are students doing now? Are they reading through the books? Are they going on the websites? Are they actually taking this serious? Because at the end of the day, this is going to be a very competitive thing when they apply. You know, they have to worry about everybody in the entire country. And that's what I really try to stress to our students. It's not just your class. It's not just the city of Cincinnati. You have people who are going to be taking AP courses and things of that nature. So you got to really take a lot of things into consideration when thinking about that.
So you said the ACT is coming up in June, but will that be online? I mean, they're not going to put everybody in a big room, are they?
They're going to, from what I know now, so they canceled April because everything was very wild. From what I understand, they're going to space people out six feet apart. The class size is going to be extremely small. They haven't released any update as to they're going to cancel the June 13th test. So what I'm thinking is they're going to have everybody spaced out as far as possible. They are moving to an online format where students do have the opportunity to take the test online, so they won't have to be in the same space for 4 hours. Well, they're going to have to be in the same space, but they don't have to be in the same room very close to one another. Yeah, so that's what I'm thinking. They haven't released anything yet. I've been checking the website every day, and I've done a couple of professional developments with ACT to make sure and see what they're trying to do to recuperate.
Okay.
And those students that are enrolled in AP classes, those test exams are still happening, and it is from your home. They changed the format, so it's about a 45-minute open-ended exam. And then I would just tell our students, they are the digital natives. So they are used to the social media. I would say if they have, and my kids, I have one in college, before she even hit campus, she knew several of the freshman class because they are on these social websites. They are doing these open houses among themselves virtually. So I say to continue to connect with the freshman class coming in, upcoming freshmen. And the universities are doing a great job. I have one at OSU. Her graduation is tomorrow. It's virtual. So the universities are stepping up their game. Our kids, this is how they communicate. We are catching up to them.
Right.
And they know their peers, and I just support that.
Excellent. You know, I want to just say that Shirley Easley, one of our Nefertiti winners recently, has some information for some online math resources for students pre-K through 6th grade. She said one is called splashlearn.com, like you splash into a pool, splashlearn.com. Another one is ABCYA, like ABC.com. Another one is Zern. It's like learn with a Z. And she said there are some others for elementary students. So Ms. Shirley, if you could send those to COVID-19communityresources.com, we will get those on the website as well so that people know. And there's another comment from Renee Mahaffey Harris, and she just wanted to point out that some colleges, including the University of Cincinnati, are waiving the ACT, SAT testing requirements. I don't know if that's just for this year or forever, but at least for now. And then Dr. Robin Ford said Harvard edX has virtual graduation online on May 20th. So, okay, thank you for that information, Dr. Ford.
There is one other There's one other additional site. It's powerhomeschool.org, and it's self-paced and interactive, and it's for K to 12. And that's powerhomeschool.org.
Okay, all right. Thank you so much, Vanessa. Someone else asked the question, and this, Ms. Harris, this is for you. When will the daycares reopen?
Well, we don't know yet. We're waiting to hear from the governor on when daycares can open. But one of my concerns is that we are going to need to have more space for less children. And I think that might be across the board, that more space is going to be needed for less children. So I'm wondering how everybody feels about that and what kind of plans are being made, because we're not going to have enough space to house all of the children that we had in the past. So how will we house all the children? If we're going to have social distancing, that's going to be really difficult. So has anybody considered that or concerned about it?
Yes. I think one of the things, Ms. Harris, you raise an excellent point. When you talk about the social distancing and young kids, first of all, we have to figure out when they come into preschools and those daycare centers, are they going to wear masks? Or the little kids want to keep their mask on or take the mask off? They haven't seen their peers in months as well. The other part that I think we need to really remember, that the temperature piece becomes a very important part of what happens in school. So several months ago, if a student had a temp, we could keep him isolated in a particular room, let his mom come and pick him up. If mom couldn't make it, we put him back on the bus, he makes his way home safely.
Right.
Well, that's gonna be out the door. That won't be able to happen. So there's some social conscious issues that we have to make sure that we're aware of. Doing business the way we did it before, that's not gonna happen. And when you talk about the governor making the declaration to reopen school, what happens in that classroom as soon as you have a student who has a temp? Well, guess what? Is that particular room, does it have an issue? Do you have to go back and revamp and deep clean the room again? Do all those students go home? Do they start working remotely? So I'm really with all of these conversations as it relates to opening school up very, very slowly, because we have to be very careful that we don't overwhelm the system with adults as well as children. So the daycare piece is very, very fragile, because kids like to be in interactive situations with other children. They touch, they feel, they talk, they share all of these ideas about what the environment looks like, what social consciousness looks like, what my attendance pattern looks like, my clothes, my style, my hair. And so we have to be very, very aware that when we start putting people back into these positions called school, what are the other parameters and the other barriers? Because our littles will not understand that I have to be 6 feet apart.
Yeah.
Okay,
Also,
thank you.
There's been no mention, I'm sorry, Jan.
No, Ms. Harris, go right ahead.
There's been no mention of PPE for childcare workers. And childcare is a very nurturing experience. So there's no way that we cannot nurture children who come to the daycare center. That's for everybody. So I'm really concerned about how we're going to transition people back into the center. And I'm also a little bit concerned about how will parents feel about returning their children to daycare centers. How will they feel? How can we ensure safety in the daycare setting? That's going to be a tough one. And
Yeah.
whether or not we have teachers that will be willing to put themselves on the front line. We're essential workers as well. So we may not have as many children and we may not have as many teachers. So it's a little bit scary.
It is scary. Thank you for that, Ms. Harris. So there are a few questions for Mr. Hodge, and we're almost ready to close. So I'm going to wrap these up into kind of one. So first of all, Dr. Chantel Thomas, who was with us before, says hello, and she said she's saying that Larry Hodge is an awesome tutor. You've helped both of her sons, and she wants you to speak about how your tutoring service works and give information. Someone else asked how you can help their children prepare for the ACT. So I would say just to answer all of those, and thank you, Dr. Thomas, and the other person who is anonymous, can you just give us your website? And of course, we'll link people through COVID-19 community resources.
Yes, so I'm going to do you one better. I'm going to put my phone number. I'm going to give everybody my phone number. I
Okay,
don't
right
mind,
ahead.
business phone. It's
Okay.
513-225-5492. That is the number. When you call in, you will get somebody from my team, and we will sit down and talk to you about what it is that you need. We are on social media. We do have a website. It is www.hodge-edullc.com. It is currently being revamped. We took some pictures. We got some more web design, and then this pandemic took place. So it is a website, but we are currently working on it. And they can reach out to me on any one of those platforms, and we can get back to them. What I would say is, for somebody attempting to work through ACT, the number one thing that I'm telling everybody to do is this. And I wanted to say this earlier. I've been working with as many parents as students, because I invite them to the actual session so that they can know, because the learning clearly doesn't stop when we get off. They're going to ask questions. I might not be around, so I sit down with parents. I make sure that they understand the math as well. And what I would say is, make sure that we really hone in on those fundamentals, especially the things that the districts are providing. So that English class, taking those AP courses, making those math classes worthwhile.
Okay, thank you so much. And I was going to say, this is just, someone made a comment here in the chat room that this is a great time to motivate parents to get more involved in their child's learning. So I think parents are definitely motivated, and with the tools you've given us, that will be helpful. Dr. Ford, to you, I know you're asking about the practice college exam, the classic learning test, and you're giving us a website for that, cltexam.com. So there are ways to practice, and I know that our schools, as well as Mr. Hodge, will have information on their websites about that as well. I think we've answered. Let's see, Samad Azazir Azwad Muhammad said, this is an opportunity to influence the Black community's spending habits with laptops versus Xboxes. And he says, what are your thoughts? I think we all agree. Let's get those laptops in the hand, those Chromebooks, laptops, whatever, in the hands of all of our children. It's so important. As Vanessa White said, we can do even virtual tutoring. You can reach out, and Ms. Amat said the same thing. Reach out to your teachers, reach out to another student. We can all help each other. And Ms. Harris said we can. We can do storytelling. I want to tell you, Michelle Obama reads a child's story every day at noon. So your young kids might want to hear our former First Lady read to them. And President Obama said she's awesome. So don't miss it. Okay, everybody, it's time to wrap up. Okay, Dr. Ford is saying every parent needs a map. Thank you, panel. Great session. Okay, Dr. Ford, you said exactly what I wanted to say. We have such a great panel. My daughter's telling me there is a survey that's coming up online in the chat room. So please fill out that survey. We just so appreciate all of you being here. I just want to say, before I turn this over to Renee, the next Saturday at 4, we're going to talk about stress, anxiety, mental health, and much more with members of the Black psychologists. So you definitely want to stay tuned for that. I just want to thank our panelists. You've been wonderful, and attendees, great questions. And I really want to give a huge shout out to Renee Mahaffey Harris and the Center for Closing the Health Gap for powering up these great partnerships and town hall meetings. We really need this in our community. We are going to get through it. We're going to get through it together, as we all keep saying, and we're going to come out even better on the other side.
Can I share one more thing?
Yes,
if you don't mind?
Sure.
I want to share one more thing. In my role as Senior Vice President of Strategy and Advocacy, as I mentioned before, this policy issue is critically important, and a lot of, as I've listened to many of the sessions and conversations around the state, policies need to change too. Dollars follow policy. and a lot of the policies are inequitable. And so one of the things that we're gonna start doing at the Urban League is start to educate families, the community, and parents about policies that are not in our best interest as a Black community. And so we're gonna start a series called Policies That Matter, activating our community. And so I'm gonna be sharing, going deep in and educating families about policies, and hopefully we'll learn to advocate to change some of the things and some of the ways dollars are being directed away from education, especially public education.
Excellent. That is fantastic. Thank you so much. Panelists, you're golden. We just really appreciate all that you've done and all that you continue to do to help our children, to make sure our children are educated and taken care of. You know, it's a hard job. All of you are just doing such a great job at it, and we just love you and appreciate all that you're doing. Everybody, don't forget that chat room to fill out the survey. And let me turn over our closing to Renee Mahaffey Harris, President and CEO of the Center for Closing the Health Gap. Here's Renee.
Thank you, Jan-Michele and Kearney, our council member, for moderating both of our sessions today. And I want to thank all the panelists. We've gotten such great feedback. I hope you will join in next Saturday at 4 p.m. For our psychologist panel. Stress is a huge factor that contributes to many of the disparities that we now find ourselves in and that we have to deal with for a lifetime in our community that is now being highlighted. So I want to thank you all. Education and preparing our babies and our children are so key to the future of our Black communities. And so I thank each of you for what you contribute to the educational system. I want to encourage you to please post the information that you shared today to covid19communityresources.com. I also want to thank our partners, the Urban League of Greater Cincinnati and Southwest Ohio, Eddie Cohen, the president and vice president of the NAACP, Robert Richardson, and Joe Mallory. I also want to thank the president of the African American Greater Cincinnati Northern Kentucky Chamber of Commerce, Eric Kearney. And I want to thank Dr. Roosevelt Walker of the Cincinnati Medical Association. They are a team that helped make this possible, as well as over 18 other organizations that you can find on our site. We have many partners. We are working together, and I think that's what this is all about. Together, we will get through this time, and I thank God for all of you. You all have a great rest of the day.
Thank you.